Does your quality of life have to change just because you're getting older?
Can it change for the better?
Can 60 really be the new 40?
Absolutely.
Quality means you don't settle for less.
Quality care is about living your life.
And quality healthcare is precisely why I practice at St. Vincent.
The Longevity Center and Dr. David are two more reasons to choose St. Vincent. Inspired.
Alzheimer's is a progressive disease, starting out slowly with memory loss. But there are signs to watch for and tests that can be done to find out if you're at risk. We sat down with Dr. Sauer for more.
The real symptoms of Alzheimer's start with short-term memory loss, and as the disease progresses, it begins to become more intermediate and then long-term memory loss. People understand that something is wrong, that their memory is not quite right, and this can make them feel very afraid and very scared. These types of feelings long-term can certainly lead to depression. It's also important to understand that depression can look just like Alzheimer's, but not be Alzheimer's. So differentiating between the two takes a lot of skill, patience, and is required for good care.
So what is the difference between Alzheimer's and dementia?
Dementia is like saying the word tree. It's a very broad category. And Alzheimer's disease is like saying oak tree. It's a specific and the most common type of dementia.
Typically, how long will a patient live after being diagnosed?
Average lifespan for a person with Alzheimer's is 11 years, but you have to take into consideration other factors, such as other medical conditions, the type of care they're receiving, how early intervention started to help with their Alzheimer's. So it can vary anywhere from 4 to 5 years up to 20 years in some cases. There are genetic markers that we know increase the risk of developing Alzheimer's. It's called the ApoE4 allele, and if you have 2 of a certain type, you have about an 80% chance of getting Alzheimer's. If you have 2 of a different type, you have a much lower chance of getting Alzheimer's. But the most important factor is age.
There's also something known as early Alzheimer's. Patients diagnosed with Down syndrome tend to develop the disease in their early 30s, while those who suffer post-traumatic stress disorder may be at a higher risk for developing Alzheimer's in their 50s. For today's St. Vincent Corner Clinic Report, I'm Jancy Sheets.